All right, so let's get back to healthcare. So the healthcare facility organizational structure displays chain of command, shows lines of authority, identifies healthcare workers' position, and identifies who your immediate supervisor is. So let's think about this at the level of a high school. So here would be the students, this would be the faculty, and then this would be your administration, Ms. Shermer, who reports to Ms. Tobias, and the ultimate authority at this school is Ms. Tobias. But if you look at Durham Public Schools as a facility structure, then Mr. Key would be above her, who would then have Dr. B. Coates above him. So that kind of gives you the structure within the school. When you think about healthcare, you have ancillary staff, which is the janitors, the housekeepers, those kinds of people. You have the security guards, you may have the CNAs at the next level, but these people do not necessarily report to those people. It looks more like spider legs. So the governing body happens to be the board of directors, and they're responsible for the provision of safe and adequate care at a reasonable cost. They also make facility policies, and they delegate the management of the hospital to an administrator. Those of you who are thinking about Durham Regional, that would happen to be Carrie Watson currently, who is the president of Durham Regional Hospital. So underneath the administrator, the board of directors, the administrator, you have department heads, and they have specific areas of responsibility. So you may have a department head that handles finance, one that handles nursing, and one that handles radiology, ancillary services, etc. Their job is to supervise the staff of their department. So you also have a medical director, and their job is to supervise the medical staff activity. Notice I said medical, not nursing. Their job is to mind the physicians, the physician residents, and the physician interns. Then you have the director of nursing and the assistant director of nursing, whose job is to supervise the nursing staff's activities. They're responsible for ensuring safe nursing care to all patients, and the registered nurses function underneath them. Then you have the nursing supervisor, who assists the director of nursing. This person is a licensed nurse, typically a registered nurse, and they have a certain assigned area of responsibility. For example, those of you that were in Health Science 2 with internship may have spent some time on the different floors. The managers of those floors are nursing supervisors. The charge nurse has specific areas of responsibility as well, and they actually report to the nursing supervisor for that area. So they are responsible for resident care in that specific area. Underneath the charge nurse, you have registered nurses, LPNs, licensed practical nurses, and nursing assistants or nurse aides. So long-term care facilities are regulated. At the federal level, they are regulated by Centers for Medicare and Medicaid Services, and at the state level, they're regulated by the Department of Health Service Regulation. Why is this important? So the federal agency that works with the two state agencies run two national programs, which are Medicare and Medicaid, which are the major payer for health care, including nursing home care. They also set the standards for long-term care facilities. Nursing homes have to be certified to receive funds from Medicare and Medicaid. Now, I said they're the major payers, so you definitely want to be certified by Medicare and Medicaid. So Nursing Home Compare for Consumers is a 5-star rating system. It provides and gives you information about the quality of care at a facility and the characteristics of the nursing home. So two sections at the state level of the Department of Health and Service Regulation are nursing home licensure and certification and healthcare personnel registry. Why do you care about this? So the nursing home licensure section and certification section determines the location and the number of nursing homes that are needed in the state of North Carolina. So if you think about Charlotte in contrast to Ahoskie, North Carolina, Charlotte has a large population where Ahoskie has a smaller population. So if we have more aged people in Charlotte, we need more facilities. So DHSR license section also issues licenses to nursing homes giving permission to operate and provide care. And, of interest, surveyors conduct inspections to find out whether the nursing home meets federal rules. There's routine inspections that take place in the homes that receive payment through Medicare and Medicaid. They are inspected every 9 to 15 months. The average survey takes 3 days. Responsibilities of the nurse aide during the survey process is to provide quality care, protect the rights of the residents, provide for the resident and personal safety, keeping the center clean and safe, which means no drinking and no food laying around outside of the cafeteria, conduct yourself in a professional manner, demonstrate good work ethics, and follow the policies and procedures of the center. And when a surveyor asks you a question, you answer the question honestly and completely. As a student, you are in a very luxurious position because you can actually say, "Excuse me, but I am a student. Let me go get my instructor." So long-term care facilities can be put on sanction because of substandard care, and they can also be fined with a civil money penalty. Civil money penalties are fines that are collected as a result of nursing home violations. Fines are redirected back in the nursing home industry to improve the quality of care. In North Carolina, Win a Step Up is funded by civil money penalties. So the second section is the Healthcare Personnel Registry section. There are 2 branches of that, the investigative branch and the Center for Aid Regulation, which is nurse aid regulation and education. The investigation branch is responsible for healthcare personnel registry, receiving reports from healthcare facilities, unlicensed healthcare worker investigations. They list pendings and findings on the Nurse Aid 1 and healthcare personnel registries. The Center for Aid Regulation and Education branch is responsible for the Nurse Aid 1 registry, training and competency programs, Medication Aid Registry and their competency programs, Geriatric Aid Registry and their training programs, Feeding Assistant training curriculum, and providing registry access and listing verification. So once you pass the CNA exam, you will be listed on the registry. So North Carolina state license that honors excellence in the workplace for people employed by home care agencies, adult care homes, and nursing homes is the North Carolina New Organizational Vision Award. Facilities that have the following can get this award: well-trained staff, satisfied and loyal workers helping families by caring for their loved ones, stronger links between coworkers, residents, families, and management, chances for the staff to better their skills and advance their careers, stable quality workers are available for now and the future. So having a faculty, an organization and staff that has won the North Carolina NOVA Award ensures better training and better staff. So nurse aides have to provide good care and comply with state and federal regulations. If this doesn't happen, your name can be placed on the North Carolina Healthcare Personnel Registry for a pending allegation or unsubstantiated allegation. So what does that mean? So let's just say that you sit for the CNA exam and you're doing really, really good, and on a Friday night you decide you're going to go drinking. Well, you guys are all underage and you get charged because you get busted. So your name will actually go, because you are a student, underage drinking. Sorry about that, guys. Your name will actually go on as a pending allegation of underage drinking. So if I choose, I can go in and I can look to see if student A is on that registry and if something has happened. Once you go to court and you are found guilty, That is when your allegation now becomes substantiated, which means that someone has found that yes, this happened. And could you potentially lose your CNA? Yes, you can. So consequences of inappropriate actions by the nurse aide student or the CNA. The nursing home and other facilities have to access the registry before they hire you. The listing will include your name, the nature of the finding or the allegation, the status of the investigation, and listings on the North Carolina Healthcare Personnel Registry will also be listed on the National Practitioner Databank. So if you do something in North Carolina and then you decide I'm going to move to California, they can actually find it there as well. So the National Healthcare Practitioner Databank, Healthcare Integrity and Protection Databank, you are considered a practitioner, and substantiated negative findings for nurse aides will appear in the National Databank. So deficiencies can be cited against the long-term care facility where you are employed. If they hire you and you have something sitting out there on the registry, they will fire you. So in order to prevent problems, you want to provide good patient care, resident care, give it with a good heart, using good standards every day, all the time, means a great CNA who's nothing to fear and everything to gain. So again, you have to be careful professionally and you have to be careful personally. So in order to prevent problems, we need to wash our hands of abuse and neglect, drug diversion, fraud, misappropriation of property, or your career could go down the drain. And that's not just your CNA career. That would be your career in the nursing and medicine field. And this ends our 1.01, Understanding Healthcare Facilities and Organizational Structure with focus on long-term care facilities.